The title of this talk today is Compounded Drugs, Valuable in Hospice, End-of-Life Care, and Palliative Care Outpatient Practice. George Muller, a compounding pharmacist for 40 years, and I published this material in the International Journal of Pharmaceutical Compounding. We're going to discuss effective prescribed drugs in hospice employed in formats not commercially available and modified to a patient's need. These include creams, gels for local or systemic effect, decubitus infected and bleeding wounds, nausea and vomiting, pain and dyspnea, and rectal pain. Of the creams and gels, there are three that I would mention. One is morphine cream, which has been reported to relieve painful wounds and painful decubitus ulcers. Phenytoin or Dilantin paste or cream has much evidence-based studies documenting its value in healing decubitus ulcers which are healable. And ketamine cream or gel, which is being studied and widely used for local somatic and neuropathic pain. Phenytoin was noted years ago in epileptic children on long-term phenytoin to develop overgrowth of gingival tissue to almost cover part of their teeth. Evidence has shown that phenytoin can stimulate the regrowth of normal tissue in decubiti and other wounds if the tissue is otherwise healthy with adequate blood supply. A 5% paste or gel in a 30-gram tube is compounded, applied once or twice to the open wound daily. Morphine cream for painful wounds has been reported to be useful in relieving the pain caused by the dressing wounds or to relieve chronically painful wounds. Morphine 1% cream can be applied to the wound 15 minutes before dressing or every 4 hours as needed for chronic pain. Morphine is effective on an open lesion, not on intact epidermis. There is no systemic absorption and no additive effect on other opioids being given systemically. Transdermal ketamine in a 5 or 10% gel with or without lidocaine, clonidine, or gabapentin is effective in relieving or reducing pain when applied locally to areas of head, neck, back, extremities, or to the anus or perineum for nerve-related pain. Apply it once or twice daily with a gloved finger and advise the patient after applying ketamine to avoid taking a hot shower so that ketamine absorption is not increased. In bleeding and infected wounds in hospice patients, we are confronted with large, bleeding, necrotic, purulent, foul-smelling wounds due to head, neck, and breast neoplasm, which are difficult to manage and cause distress to the patient, family, and staff. One effective management after cleansing the affected area is to puff a mixture of powdered flagyl and chloramphenicol or ciprofloxacin by means of a small plastic insufflator or bellows to the wound surface every 1 or 2 days. It sometimes is dramatically effective. In controlling the bleeding and wounds of the body surface, Thromin is commonly used to control bleeding of oozing necrotic neoplastic lesions. It can be added to puff drugs applied to control infection. It is expensive. Moncell's solution, ferric subsulfate, an older drug, coagulates bleeding from open wounds easily when painted or dabbed on the site, much like a styptic pencil. It is also used currently to stop bleeding from slice biopsies in dermatology and colposcopy biopsies, and it is available commercially. In nausea and vomiting, in difficult situations that are difficult to relieve, the effective evidence-based combination used for refractory nausea and vomiting is called HABR, in which haloperidol acts on the vomiting center, or the chemoreceptor trigger zone, and on dopamine receptors. Lorazepam reduces cortical-induced nausea. Benadryl acts on the extrapyramidal side effects of haloperidol and metoclopramide, and it acts on the CTZ. Metoclopramide increases GI motility. It acts on the CTZ, dopamine, and serotonin receptors. So the usual combination: Haldol 1 milligram, Ativan 1 milligram, Benadryl 25 milligrams, Reglan 5 milligrams. One can decrease Haldol or Ativan to 0.5 milligrams or add Decadron if it's indicated. It's available as an oral capsule, short-acting, a capsule every 6 hours as needed, or the long-acting every 12 hours. It is also available as a liquid and as a rectal suppository, dosed every 6 to 12 hours rectally as needed. There's some question about the transdermal gel as to its value. When one is faced with an intractable cough which has not been relieved by conventional medications, nebulized lidocaine may be useful. And we've used it when a persistent cough due to cancer or chronic lung disease is refractory. Lidocaine 1 milligram of 2% sterile solution added to 3 milliliters of sterile saline can be nebulized every 3 to 4 hours. It can be prepared in a sterile aseptic environment if it's compounded. However, alternatively, a milliliter can be withdrawn via a syringe from a manufactured 20 milliliter vial and placed in a nebulizer with 3 milliliters of normal saline from a sterile prepackaged vial. In the relief of pain and dyspnea, oral concentrates of solutions of morphine, levofinol, methadone, and oxycodone are often used to provide relief of pain or dyspnea in patients who are unable to swallow safely, especially in patients who are nearing death. Used in small doses given buccally or sublingually, absorption by some is mucosal, by others via the upper GI tract. Fentanyl and methadone are absorbed fastest. The oral opioid concentrate morphine solution is commercially available as a fixed 20 milligram per mil oral concentrate in a 30 milliliter dropper bottle. But when smaller or larger concentrations are desired for a patient, compounded morphine can be provided at a range from 10 to 60 milligrams in a 15 to 30 milliliter dropper. Standard dose for pain and dyspnea is 5 milligrams sublingually every 2 to 4 hours, but depending on the intensity of symptom distress, dose escalation at a more frequent time may be needed. Methadone is often the drug needed for intractable pain. In patients unable to swallow, a concentrate suspension of methadone, 20 milligrams per mil, is most often used, supplied in a 30 ml dropper bottle, and because methadone is bitter, it is best flavored with chocolate, mint, and raspberry. Concentrations are available from 10 to 60 milligrams per mil in a 15 or 30 milliliter bottle. Levofinol and oxycodone can be provided in oral concentrate solutions as well. Levofenol is compounded most often as a 4 milligram per ml concentrate suspension in a 30 ml dropper bottle. It is best flavored with pina colada. It is available in 2 to 8 milliliter concentrations, and it is an excellent alternative to methadone for refractory or neuropathic pain. Oxycodone oral concentrate is used when morphine is not tolerated. Again, it is 20 milligrams per ml in 30 ml dropper bottles, and its dose is similar to that of morphine. Nebulized morphine for the relief of dyspnea is controversial. It is not effective in chronic obstructive lung disease and interstitial pulmonary fibrosis. There is some evidence that morphine nebs help dyspnea in cancer patients more quickly than opioids given systemically. It may help relieve dyspnea due to congestive heart failure based on the dramatic effectiveness of morphine in acute pulmonary edema by rapidly shunting blood into large vessels of the abdominal visceral organs. Ketamine, an anesthetic given IV and sub-anesthetic doses, has been used for years to relieve neuropathic pain by blocking the N-methyl D-aspartate receptor in the spinal cord, as does levofenol and methadone. It is possible to use ketamine orally, intramuscularly, in creams and gels, and by nasal spray for pain relief and relief of depression in some cases. Ketamine gels and creams, 5 to 10% applied locally to painful regions, are useful. Oral and intramuscular ketamine are being studied to confirm its effectiveness in reducing pain and depression. Ketamine nasal spray is being used for breakthrough pain. It should not be used in patients with seizures or seizure potential. The best reference is by Eric Prama in the Journal of Palliative Medicine in 2012, Ketamine for Pain, an update of uses in palliative care. In rectal pain, pain due to anal fissure or thrombosed hemorrhoids has been effectively relieved by inserting a compounded rectal rocket into the anal canal. The rocket remains overnight held in place by flanges, allowing the lidocaine and hydrocortisone in the suppository base to be absorbed into the inflamed tissue. Morphine cream is effective for rectal pain, and ketamine cream for rectal pain, particularly of the anus and perineum, has been remarkably effective in some of the cases that I've managed. In conclusion, compounded drugs allow flexibility in dosing and access to drugs in delivery systems not commercially available in the format needed. Contact your local compounding pharmacist to get more specific information about these compounded drug uses, the formulas, the directions for patients, the contraindications for their use in specific patients, and the cost. Thank you.